Hi guys, my name is Sydney. I'm a registered nurse here at New Age Medical Aesthetics, and I'm here with our lovely patient Olivia. And today you're gonna come with me and we're gonna do some injectables. So Olivia, today we're coming in, and what is it that you're looking to get?
I'm looking to get some Botox in my forehead area.
Okay, amazing. Is there anything in particular that was bugging you and that's what brought you in today? Or what is your thought process behind getting it done in your forehead?
I find my lines pretty deep.
Okay.
And I can see the lines when I'm at rest, more so on my forehead, and then this line as well.
Okay.
In between the eyebrows.
Gotcha. So I'm gonna hand you this mirror, and then we're gonna take a pencil. I'm gonna start to draw on you a little bit, and that's just to figure out your dosing in terms of how many units you're gonna need for the injections. Let's start from the top to the bottom. So with your forehead area, if you wanna look into the mirror, you can let me know. So go ahead and move your forehead up for me. Okay, so you see how we have some of the lines that are going a little bit deeper here and here? Mm-hmm. Something to just note is that because the frontalis muscle, which is your forehead muscle, is the only one in the upper half of your face that holds everything up, we got to be really careful about freezing it because we don't want to drop your eyebrows and make you look like a caveman.
Okay, I do actually like the more natural look and not being super frozen anyways.
Perfect. Okay, that's so good to know because then I can adjust your treatment based on that. What I like to say is from 1 being how you are right now, no Botox at all, to 10 being a skating rink.
Okay, super frozen.
Super frozen. How frozen do you want to be?
Probably like an 8. Previously, I still liked seeing the movement in my forehead, just no wrinkles.
Just no wrinkles.
Yeah.
Okay, so we're looking for at rest, we don't see any lines, but we're still able to show expression.
Yeah, exactly.
Okay, perfect. So we're going to start with the forehead area. So because you do have some lines that are just a little bit lower, we do have to be really careful. We don't want to drop your eyebrows.
Okay.
But so that means that we're going to stay above about here with the injections. And if you do in fact find that you still have some spots that are coming through after, we can totally do a touch up, no problem.
Perfect.
Yeah, go ahead and raise your eyebrows for me. Perfect. So I'm going to go ahead and just mark a few spots that I see that would be really good to inject. The Botox or the neurotoxin I'm using has about a centimeter in diameter for the diffusion rate, so how far it'll spread. So I'm just going to space these out appropriately and make sure that they're not too close together and they're spread out enough, but also that they're not close enough to your eyebrows. I think that this is like a great pattern for how your muscles interact with one another. So let's go down into making an angry face. You mentioned that you don't like this guy. Mm-hmm. And so how frozen are we looking to be here?
I think the same, still some movement. Get rid of the wrinkle.
Get rid of the guy?
Yeah.
Okay, so go angry again. Okay, so we'll do an injection here, here, and relax, and go again. Good, good, and relax. Close your eyes like you have shampoo in them. Perfect. So I think that we could do a little bit here. I would say based on my personal experience, I don't feel the same tension necessarily that you feel sometimes whenever your Botox is either starting to kick in or it's time to start doing your Botox again. So I feel more so that around your eyes, it can impact the way that you're squinting, and in those aspects, if it is impacting you there, then I would say, yes, you can feel the movement. We're aiming to be really soft with our injections, and it's not a race by any means, so I think it's always safer to undertreat than to overtreat, just because Botox doesn't have an antidote medication. Start slow and build up.
Yeah.
Cool. So we'll start getting that medication prepped. So first things first, I'm just going to cleanse your face just with an alcohol swab. We're going to let it dry and just make sure the area is all clean before we start our injections. Okay. So face me, and you're gonna go ahead and do a lift with your eyebrows. Perfect. Good, so little injection here, little pinch. How was that?
Not painful.
Good. First one, done.
Beautiful.
Go up again. Good. You're doing okay so far? Mm-hmm. And go up again. Good, little pinch here. and up. And again. And relax and go up again. Good. Forehead is done. Quick step. How's the pain?
Good. I didn't feel that.
No. Good. Okay, so go angry for me. Good. And we're gonna aim to get rid of this guy.
Please.
I'm gonna grab the muscle here. Don't mind me, I'm going to go kind of along your bone right here.
Okay.
And that's just kind of to hold the muscle. There's a best practice that studies have been showing. It can help minimize the risk of getting apoptosis, which is whenever you have an eyelid that has kind of fallen a little bit or your eyebrows fall a little bit from the Botox. And go angry again. Good. Relax. So you might experience a little bit of bruising or bleeding, and that's completely normal.
Okay.
So then we're gonna move to your eyes. And so go ahead and go up really high and then relax and go tight with your eyes. So a little poke here, sorry. Good. Good, and relax and go tight with your eyes. Perfect, relax. Good. Perfect. Face me, and we're gonna do the injections just around the eyes on this side. Good. Good, and tighten your eyes. Perfect. And relax. So a little poke here. Good.
Yeah, those don't hurt at all.
Perfect. That's what we like to hear. So we're all done. You did fantastic. How did you find it?
Good. No pain.
Good.
Good.
Awesome. So a couple things we're going to go over is post-treatment care. Make sure that you're sitting upright or standing upright for the next 4 hours. No naps, no lying down. And make sure that you're not bending over this way and picking up things, and just try to really keep your head up straight. Anything that's going to thin your blood is something that you want to kind of stay away from for the next 24 to 48 hours. So that means saunas, hot tubs, exercise, alcohol, Advil. In about 3 to 4 days, you could start seeing results from the medication. You'll see the full result of how the medication has affected your muscles after about 2 weeks. And then on the 21-day mark, you'll start seeing how your muscles actually are settling in with the medication. And so even though you may feel, oh my gosh, my face is so frozen at the 14-day mark, just let your muscles go through the process and let them settle in with the medication. And then when we get around the 21-day mark, you'll find you'll start having a bit of movement still, and you'll be able to actually see what your result is going to be. I'll also have you come back in about 2 weeks, and then we can just see how everything has settled in, and we'll see if there's any areas that we need to touch up. And if you have any questions though, you of course can reach us anytime.
Perfect.
Yeah.
Thank you so much, and I'm excited to see the results.
Good. Yay, me too.